Okay. Yep, so everyone is muted at the moment. I'm sure you can appreciate with the numbers of amount of people that we have on the meeting, it's not possible to conduct the meeting with everyone's mics on. Okay, you can feel free to post comments and questions in the chat. You'll also have an opportunity later to ask questions, and we do encourage this, so please ask away. Please do not post any links or images or you'll be removed from the meeting. And just a reminder that we're active on social media, so you can follow us at ARCC and the Croydon BME Forum on Twitter, Facebook, Instagram, and YouTube. Yep, so I'm just going to hand over to my colleague, Tom.
Cool. Thank you very much, Lorraine. Just going to stop sharing the screen. I'm just about to share a slide with everyone. Just check it out. Okay, so just give me a moment. Almost there. Okay, here we go. Okay, so can we all see that? Yeah. Okay, so just a little bit about our project first of all. So Lorraine and myself are in a brand new project for the Cancer Awareness Program. And at the moment we are targeting and trying to help out Black and South Asian community in Croydon. As you can see in big letters, cancer is the second biggest killer in Croydon. So just a little bit more on this program. The reason we're targeting Black and South Asians is because, as you can see in front of you, there is a slight difference. So for instance, with Black men, being significantly more likely to have a diagnosis of prostate cancer than white males. And there's also a difference in survival rate as well. So as you can see, Asian women aged 15 to 64 have significantly reduced survival rate from breast cancer than white women at 3 years, but actually at 1 year, but not at 1 year or for other age ranges. And again, Black women aged 15 to 64 have also significantly less survival rate from breast cancer at both 1 and 3 years of having the cancer than white women. And this should go to the next slide. So again, yeah, cancer is the second biggest killer in Croydon. Now, what we're here to help with is obviously not to paint a doom and gloom scenario, but we're here to try and help you prevent that. So showing to primary care, and also the name it awareness is there as well. So just kind of helping us understand and be aware of what can cause and lead to cancer. You're going to see a huge amount of information over the next couple months. There's a big national campaign because, as we've been talking about Black and South Asian demographics, it's also, there's a national crisis with people not presenting or not even attending screenings. Now, I haven't got any information on hand for that, but like I said, there'll be a lot of information over the next couple months, and you're going to see a lot more of us from events. We're going to be hosting more webinars like this. There'll be focal groups. So we're going to give you a chance to be heard as well. We're also going to be conducting a poll today, asking a simple question at the start, and then hopefully by the end of the talk, we're going to ask the question again, and we'll see where we are. You may have heard of Asian Resource Center and Croydon BME Center Forum. We've already hosted an event at World Health Day, which was successful and gave us some really interesting insights. But what we're really excited about is bringing professionals and experts in to dispel any myths or taboos around cancer in both South Asian communities and Black communities. We understand that there are some myths and taboos, and that's basically what we're here to help with. So I can see the chat is busy. So yeah, fire away any questions you have. We will have a Q&A session later on, but by all means, the chat is available for anyone who wants to use it. All you have to do is simply hover your mouse to the top and you'll see a little speech bubble saying chat. If you left click on that, it will bring the chat box open. And then you can simply close it, obviously, by hitting the cross. So the other thing we're going to be doing with the project, which is really exciting, is Cancer Champions. Some of you may be aware of the long-term health projects again, it's a collaboration with Croydon BME Forum and Asian Resource Center. There's currently some health and event champions who are help raising awareness of diabetes, hypertension, and high blood pressure. You may have already seen a few of these events popping up around Croydon. And if you haven't been to one already, I highly recommend it. You get a free health check. You get about 10 minutes or so to discuss any issues you have with diabetes. And there are some other issues as well covered with that. It's also a great chance to get free one-to-one supports. And we will be joining them as well with our very own Cancer Champions, as well as myself and Lorraine. So Cancer Champions will be coming into Croydon very soon. And we're really excited because it's the first time this has happened. We're already starting to get a couple dates in the diary. Some of them may be familiar with you, such as Pride of Croydon Festival, the Croydon Carnival. But again, there'll be more dates about that later on. Lorraine, is there anything else I missed out with that?
No, that was a very good in detail explanation of what the Cancer Awareness Project is all about. And I actually have the poll here ready to go. Want to introduce that?
So I'll stop sharing the screen. Okay.
Okay, so you're just about to see a poll pop up on your screen. There we go. So we've got another 5 seconds for you all to answer. Okay, so I'm going to share this with you now. Okay, so we've got mixed views on cancer screenings. So a few of you said yes, it's on your to-do list. That means you haven't done it yet. Some people are not thinking about it at all, and some people are on the fence. Okay, so hopefully by the end of our session, you'll have more information and be better equipped to make your decision. So all the thinking about it, people, hopefully will turn into a yes. Okay. Just like to apologize to everyone again about my camera. I'm here. Okay, so I would like to introduce this evening's speaker to you all. Her name is lyna ofosu Asare, and I feel so honored personally to have Lisa speaking with us today. It is a real privilege. She's a health improvement specialist at St. George's University Hospital, and she's been in this industry for over 7 years. Specifically in this role of health improvement specialist for bowel cancer for the last 3 years. She's very passionate about everything to do with cancer. not only is she an expert in her field, but she's also culturally knowledgeable. So we know, we just like Tom said, we have all the myths and stereotypes and stigmas, beliefs that we all have. Lisa's well equipped with all of that, and she understands all of that, and she's the best person to speak to us today. Lisa Lena, thank you very much for joining us this evening.
Thanks for having me. That was a really nice introduction. Thank you.
I feel really honored to have you here, and apologies about my camera.
No, that's fine.
It's not cooperating today.
That's no problem. That's fine. Do you want me to get started?
Yes, please. Go ahead.
Okay, great. So just to introduce myself, Lorraine's already done a great job. So I'm Lisa. I work at St. George's Hospital. I'm the health improvement specialist there for bowel cancer screening. So today's discussion is really going to be everything to do with bowel cancer. So you guys may or may not be aware, but April is actually Bowel Cancer Awareness Month. So it's fantastic that we've actually got this opportunity to talk to you guys. I'm going to do a short little presentation just covering the importance of doing your bowel cancer screen, talking about how easy and how simple it is, also just general knowledge around bowel cancer, hopefully to equip you guys just to be able to just take better general care of your bowel health. And of course, at the end, we'll have opportunity for questions. So use the chat box, speak out. It's up to you guys, but any questions you have, do throw them our way. So what I'm going to try and do is I'm going to try and share my screen with you guys. Hopefully that should work. Give me 1 second. Give me 1 second. Right. Can you see my screen? Is it working?
No, I've got it available if you would like as well, Lisa.
Yeah, I think I'm trying to. Okay, no, do you know what, Tom? I need to click share. Hold on 1 second. Okay, cool. I think we're good. Are we good? Can you see my screen now?
Yeah.
Yeah. Okay, fantastic. Right. So let me just get the slideshow up. Right, so we're going to get straight into it. I'm going to talk to you guys a little bit, like I said, just about bowel cancer, signs and symptoms, also just touching on the screening program. Before we get into it, I kind of wanted to do a little bit of an icebreaker. If this was face-to-face, it would be great, but obviously we're online, so we'll try and do our best as we can. It's really just a quiz, just to kind of get an idea of what you guys know when it comes to cancer. So please, as I ask each of the questions, it's only 4 short questions, but as I ask them, anyone, I'm more than happy for you to just unmute your mic and just speak out so we can hear you. That's right, we'll get straight into it. So in terms of the first question, and I really like to ask this at the start of most of my talks, just to get an idea of people's perceptions when it comes to cancer. So when you hear the word cancer, what springs to mind? Please feel free to unmute your mics and just speak out.
Fear and death.
Fear and death.
Being scared.
Sorry.
Yeah. Yeah, fear, death, scared. No, perfect. Well, not perfect, but you're responding, so that's perfect. Any other answers at all?
End of the world.
Family, yeah. I think we had one more before I cut someone off.
End of the world.
What was that?
End of the world.
End of the world. Okay, so a couple of things that were said there is actually going to come up on my next slide. So fear and death was one, Delia, as I heard you say. Things like sickness, why, pain, chemotherapy, sadness, what to say, people feeling lost. These are actually a range of emotions and feelings that we actually got whenever we ask people in terms of when they hear the word cancer, what comes to mind. This tends to be quite common things that we hear. Instantly, for example, we heard fear and death right away. Why this is such an interesting slide is because actually what this touches on is quite often is quite negative in terms of what people think. When they think of the word cancer, it's quite scary. They think of negative things. So fear, death, sadness, what to say. And it's really interesting because what it just shows is obviously when it comes to cancer, it's not always the easiest thing to talk about. And quite often people are quite scared when it comes to talking about cancer, and they have quite negative thoughts around it. And I think what this talk hopefully will do is encourage people to take not only better care of their health and do their screens, but also to focus on the fact that actually when we think about cancer, we don't always have to have such a negative thought around it. And that's just because we know that we've got better care and better access to treatment at the moment, now, shall I say, as opposed to earlier on, many years ago. I don't want to talk too much about that because we're going to touch on that in a second. But yeah, it really is just important to let people know that it doesn't always have to be so negative. And hopefully by the end of this talk, that might change people's perceptions as well. On to the next question. Survival rates are now twice as high as 40 years ago. Do you believe that this is true or false? Again, just a couple of people, doesn't have to be too many.
True. I believe it's true.
Yeah. It is. That is very, very true. So actually where we are at the moment, we are actually at 2 in 4. So 50% of people that get cancer are actually surviving for 10 years or more, as opposed to back in the 70s where it was 1 in 4. And, you know, this is, again, a prime example of how, you know, where we are now and the fact that things are a lot better than they used to be. We obviously have, there's actually a national ambition to get to 3 in 4 by 2028. And, you know, ways in which we can encourage and we can do this is partaking in screening. So we will touch on that, as I said, further down the line in the talk as well. Third question, how many different types of cancer are there? So we've got A, 50, we've got B, 130, and we've got C, over 200. So do we have any idea of how many types there might be? Anyone?
Over 200, I'd say.
Yeah.
Over 200.
Yeah, spot on. So it is over 200. There are over 200 different types of cells in our body, and each one of those can get cancer. So it is quite a lot. There are quite a lot of different types of cancers out there. So it really is important that we just try our best to take control of our general health where we can. And our final question is, what are the 4 most common types of cancers? And I think this will lead us perfectly into our talk today. So I think I've given a hint there, but what are the 4 most common types of cancers? Again, please shout out.
Prostate one?
Yeah. Mm-hmm.
Breast?
Yes, prostate, breast. Yeah, that's 2 out of 4 already.
Bowel?
I was saying
Bowel, yes. I'm surprised that wasn't the first one yet.
I'm not sure of the last one.
So prostate, breast, bowel, and any more for the 4th one?
Brenda said bone.
Bone. No.
Lung.
Yes, spot on. So that's it is. Well done. That's literally 4 out of 4. So yeah, it is that. It's breast and prostate, lung, and bowel actually being the 4th most common. And that is going to lead us straight into our talk today. So we're going to touch on bowel cancer. I'm going to talk about the screening program, but firstly, what I wanted to do before we get into that, just to give you guys a little bit of facts around bowel cancer. It may be some stuff that you guys may know already, and that's fantastic. If not, then even better, because obviously you guys are taking away something from today. So just a couple of facts that are really important for us to highlight is it is the 4th most common cancer in the UK, as I said, and I believe Tom had even highlighted that earlier on today as well. It is the 2nd biggest cause of cancer death. So we get around 16,000 deaths a year from bowel cancer, which is actually quite a significant number. And it's quite common in over 60-year-olds. This is actually the reason why the screening program has traditionally been starting from 60 years and above. So it's ranged for people between 60 and 74. I will be touching on the expansion of that. So we're now going to actually try and include younger years as well, which I will touch on in the next few slides. With bowel cancer, a really important thing to highlight is the importance of early diagnosis. To be honest, early diagnosis is important across the board with all cancers. It's something we're always encouraging people to understand their bodies. If there's anything that seems a little bit off, I mean, we all know our bodies the best. If anything feels off, it's always important to go and get it checked out with your GP. And with bowel cancer particularly, we know that when we're looking at early stage diagnosis, so we're looking at stages 1 and 2, survival rates are 9 in 10. So we're looking at around 98% of people that are diagnosed in their earlier stages are living for 5 years or more. And that is really significant. And I think for us, we need to really focus on that, because what happens with bowel cancer, as with a lot of cancers, when we now go to the later stages, stage 3 and 4, survival rates drastically decrease. So with bowel cancer, it drops down to around 43% when we're looking at stage 3 and 4 diagnosis. So that is significant, because that's now less than half. And we know that if it was early stage and is caught at the earliest of stages, we can, 98% of people are surviving. And that again is a real important thing as to why screening is so significant. So that's just something that we can bear in mind, or we should bear in mind. 50% of bowel cancer cases are actually linked to lifestyle risk factors. I will be touching on that a little bit later on, but that's really to do with our actual choice in terms of our lifestyle. So whether we drink, whether we're overweight, whether we smoke, all these type of lifestyle factors actually have an effect on our risk for bowel cancer. And that's quite important to bear in mind, because obviously it allows us to actually look back and think, okay, is there anything that we're doing that we can actually try and reduce or cut out completely to obviously try and reduce our risk of developing bowel cancer? And we will touch on that a little bit later. Over 42,000, yes, Tom, I see your hand is up.
Hi, Lisa. I just spotted something in the chat. Delia's asked, could we define what we mean by bowel?
In terms of what a bowel is, so it's within our okay, no, that's a perfectly good question. So within our stomach, our bowel, that's inside where our digestive system is. Our bowel is what controls our when we go to the toilet, basically, in layman's terms. Whenever we go to the toilet and we do a poo, that is controlled all from our bowel, and that's obviously inside the lower part of our stomach. And that is where, whenever we're doing bowel cancer screening, that is particularly what we're looking at for where there's any types of growths. And I'll be touching on that. But inside of our bowels, particularly, we're looking for something called polyps. And polyps are basically small growths that could, sometimes they can turn into cancer, not always, but sometimes they can. And the bowel cancer screening program is basically looking inside to check and see, are there any growths? Are there any cause for concerns? Do we need to do further testing? And, could we prevent a cancer, or could we diagnose a cancer at the earliest of stages? So hopefully that helps answer your question. Any other questions at all?
Delilah? Cool. Nothing else. No, thank you.
Yeah. No problem at all. Over 42,000 people are diagnosed with bowel cancer every year. And also, final thing to really highlight is 1 in 15 men and 1 in 18 women will be diagnosed with bowel cancer during their lifetime. So that's quite a significant number again. And it shows that it's slightly a little bit more common in men than it is in women. And I think one thing that I always highlight with the bowel cancer screening program is that, when it comes to screening, there's only actually 3 national screening programs. So people are quite often quite surprised because they believe there's more, and there's actually not. At the moment for cancer, the only 3 screening programs we have are breast, cervical, and bowel being the only one that actually includes men. So obviously with breast and cervical, that's just for women. With bowel cancer, it is a test that can be done by both men and women. And I think, considering this is the only screening program that does include men, it's fantastic if men take that up. Both men and women take up the option to actually do the screen when the opportunity arises. So those are the main facts when it comes to bowel cancer. Hopefully that has given you guys a bit of information or something that you may not have known. Hopefully you've taken away something new from there. So yeah, those are the main things that I want you guys to bear in mind. Our next slide is talking about the actual symptoms of bowel cancer. So with bowel cancer, there's a few symptoms that we encourage people to look out for. So what we say particularly is if you notice a persistent change in your bowel habit, so that could be either going more often or not going enough. So for example, if you've got diarrhea, or if you're noticing that you're actually quite constipated and you notice it over a period of a couple of weeks, that could be considered a cause for concern, and definitely important to get that checked out with your GP. Also, if you notice any bleeding from your back passage, so either blood in your stool or when you're wiping, and this is pretty significant because what this highlights is the importance of actually checking when we go to the toilet. And I think one of the things that, you know, I find when I'm having discussions around bowel cancer, and particularly when you go to the toilet and checking, quite often people don't. They will go to the toilet, they'll do a poo and they'll wipe and they'll kind of flush and that'll be it. There is no checking or inspection to see, okay, how was that? Does my poo have any blood in it? Was there any blood on the tissue when I wiped? And it's really important that we actually get into a routine and you know, make it a normal habit for us to actually check and see, you know, whenever we go to the toilet, if there's any blood behind. I think that's something that's really important. And I always try and highlight that if people can just get into a routine of checking after they go to the toilet, it can definitely help with identifying if there's any blood or any cause for concern there. Also, if you notice a lump or a pain in your lower tummy, and also unexplained weight loss. Now, unexplained weight loss, and as with a lot of these symptoms here, to be honest with you, can be attributed to a range of things. It does not mean because you have lost weight without intentionally trying that it's cancer. Of course, it does not mean that. What it does mean, though, is that there might be something more sinister going on, and it's really important to get it checked out. We say when it comes to each of these symptoms that if you notice it for a period of time, for 2 weeks or more particularly, then it's definitely important to go and see a GP. The reason we say 2 weeks is because, you know, if it's only a couple of days, for example, and you notice you've got a bit of diarrhea or you're a little bit constipated, that could easily be attributed to maybe something you've eaten. It could be to do with your diet. So, you know, if it's only a change in habit only within a couple of days, quite often there could be something, you know, you can pinpoint it down to something that might have happened or you might have eaten that might be causing that. However, if you notice that there is a change in your particular bowel habit, or, you know, there is a lump in your tummy for a period of time longer than 2 weeks, we would then know that, okay, there might be something a little bit more going on here, and it's really important to get it checked out. So what we would always say, and I always highlight, is these symptoms do not mean if you have them that you have bowel cancer. It's just that these could be signs of bowel cancer, and it's very important that you go to your GP and get yourself seen too. And this obviously applies to people all across the board, regardless of your age. If you notice symptoms that are a cause for concern, always important to go and see your GP. So those are the main things that I wanted to touch on when it comes to bowel cancer in terms of the facts and the symptoms. The next few slides now are really going to be talking about the bowel cancer screening program and, you know, the importance of doing it. And, you know, any questions, like I said, feel free to either save them onto the end, or as you have been doing, pop them in the chat box and Tom can let me know. So the bowel cancer screening program. So the bowel cancer screening program involves something called a FIT test. Before we get into it, is the majority of you here familiar with FIT for bowel cancer screening, or is this new to some of you guys on the call? Just a few people can let me know if there's anyone particular.
New.
Pardon?
It's new
for
me.
Okay. Hopefully then you guys were able to take away a bit of information around this. So the bowel cancer screening program is a national program, and what it involves is basically sending out a kit called a FIT test. And this is what the FIT test looks like. This image on here is a picture of exactly what would be received in the post, and it's called a fecal immunochemical test. And what that basically is it's basically just a way to collect your stool sample. So in order to test for bowel cancer, we need to be able to get a stool sample. So that's your poo sample. And what happens is it is basically tested to see if there's any traces of blood. Quite often it's traces of blood that are actually not even detectable to the human eye. So it's really small, minuscule amounts of blood, but enough to be able to be picked up to know if we need to do further investigations. So the way bowel cancer screening works is Nationally, as long as you are signed up with your GP and you're aged between 60 to 74, you will automatically receive this particular kit in the post. So this kit that you see on the screen is the kit that is sent out, providing you fall within the screening age. So the screening age is at the moment is from 60 to 74. What will happen is every 2 years, you will always receive this kit in the post. So it comes in the post, it comes with a prepaid envelope, it comes with the sample. So that small little green tube that you can see on the image is exactly what will come in the post. And what will happen is you use that to basically collect your stool sample. You collect your stool sample and you basically open up that tube and you just scrape it along. There's a little groove at the edge of it, and you would scrape it along your stool sample, and then you would close the tube and you would basically pop it back in the prepaid envelope, and it will be sent off to the hospital to get processed. Now, this test is actually, as I said, it's sent out every 2 years, and it's from ages 60 to 74. What we are actually currently doing at the moment is we're actually going through the process of an age extension. So an age extension is where we now include other ages, and I mentioned this earlier on, where we include other ages to allow them to be able to screen for bowel cancer. So what we're trying to do is, the aim is by 2024, we'll actually be able to include bowel cancer screening for people age 50 through to 74, as opposed to 60 to 74, which is what it has historically been. The way in which we're doing that is via a phased approach. So as of last year through to this year, so from 2021 through to 2022, we started to include 56-year-olds. So now at the moment, what will happen is 60 to 74-year-olds receive their kits, and also 56-year-olds receive their kits. Then the next approach is to now include 58-year-olds, and that should be happening over the coming months. And then it will be 56 and 58-year-olds, plus the 60 to 74-year-old age range. And then over the next 2 years, we'll include the subsequent years. So that'll be 50, 52, 54. And the aim is, like I said, by 2024, from 50 to 74-year-olds will be receiving their kit in the post. Now, the important thing to highlight here is that means that anyone younger does not receive it. And the reason I highlight that is because, I get asked, by people, obviously people younger can get bowel cancer, so why don't they receive a screening kit? And that is correct. People younger can get bowel cancer. It's not as common as it is in older years, but yes, it can happen. And that is the reason why I always talk about understanding and knowing your body and knowing signs and symptoms, because although you're not eligible for screening if you're under the age, it's still important to know if you've got any symptoms of bowel cancer, because then if you did, you'd be able to go to your GP and go for further testing. So that's why I always highlight knowing what the symptoms are, because if you are not eligible for screening, you can go for your go to the GP. And even if you are eligible for screening, it is still very important that even if you've done a fit test, a test that's come through in the post, and you have a negative, for example, if you start to develop symptoms at any point, it's still important to go and see a GP. So that's something I always want to highlight to people, that regardless of doing a screening test, if you ever get symptoms of bowel cancer, always make sure you go and see a health professional. So this is the test. As I said, you'll receive it in the post. And yeah, it's a really simple test, really quick to do. I always say, quite often people don't do it. And, it's one of those tests where we all go to the toilet. So it's not asking you to do anything that you don't already do. And it's actually the only screening program that doesn't involve a health professional. So with a mammogram, you would have to go in. With breast screening, you would need to go in and get a mammogram done. So you need a health professional. The same with doing a smear test, cervical test for females. You would need to go and have a health professional take your smear. Whereas with bowel cancer screening, it is no health professional involved at all. It is in the comfort of your own home, in your own toilet. So that's another reason why we really encourage people to do it, because it is a very simple and straightforward test to do. So as I said, the test will be done and will be sent off. We'll be looking for any blood inside the stool. And what it's looking for is what I mentioned earlier on when we had the question about what is a bowel. It is basically looking for something called polyps. And polyps are basically small growths, small little growths inside your stomach, inside your bowel. And what they can do is sometimes, if left They can be cancerous polyps, and one of the things that we want to try and avoid is it developing into cancer. And that's the great thing about screening. They have, you know, if you are consistent in doing your screen, there is the ability to be able to identify polyps before they even turn into anything cancerous, and being able to remove them and, you know, ensure that you are monitored to make sure that it doesn't ever progress into a cancer. And that is the significant thing about bowel cancer screening. So we always really encourage patients that do, or you know, that do get their screens, to always make sure that they do it. And you know, I can't stress that enough, the importance of really doing the screen when you get the opportunity. So yeah, that is literally it. To highlight, because people are quite interested quite often in terms of what happens when they do send it off, depending on the result. You'll send off your kit, you should get your results back within 2 weeks. The results will tell you one of two things: either it's an abnormal result, which means that there might have been a trace of blood found, or be a normal result. If it's a normal result, it's fine. You won't receive another kit until 2 years. It's every 2 years. So 60, 62, 64, 66, and so on through to 74. So providing a result is fine. Negative, normal, you will receive your next kit in 2 years. If it's abnormal, and abnormal just means that they might have found a bit of blood, it does not mean that there's cancer. All that means is that the next stage would be for you to actually come into your local screening centre to speak with a specialist nurse to discuss what that result means. So they would normally explain to you that, okay, you know, they found some blood in your stool, this is what it could mean. The next step would probably be to do something called a colonoscopy. You may or may not have heard of it. A colonoscopy is basically a way to place a camera inside your stomach to look inside your whole bowel, and to be able to look and see if there's anything of any cause for concern, and try and find out what was causing that, what caused that blood in that stool sample. So the camera is placed through your back passage, and they'll be able to get a clear view inside your stomach. And, you know, throughout the whole process, our nurses are always as supportive as ever, and they always explain to you exactly what it means in terms of doing a colonoscopy, and, you know, just encouraging you where possible, and just trying to make sure that you feel as comfortable as possible to do further testing, just to rule anything out. And that is really the process for doing a bowel cancer screen. So yeah, it's pretty straightforward. And it's just one of those things that I say, you know, when you get the opportunity, if it's sent to you in the post to do, it really is important. It can save your life, essentially. So definitely important to do the screen when the opportunity arises. So this slide now is actually just showing you the different ways in which you can collect your stool sample. So if you remember, I actually touched on the fact that when you receive your bowel cancer screening kit, what you need to do is actually do a stool sample. And quite often people are like, well, how am I meant to collect my poo? Like, what am I meant to do? And so this is a lovely, lovely infographic from Cancer Research UK, that basically gives you different ways that you can collect your stool sample. So if you hadn't thought of any ways already, they've actually broken it down for you. So, you know, you've got, there's the idea of cling film over a toilet where you have placed a little dip in it. I'm sure you can imagine how that would work. You can use containers, you can use fruit containers, you can use takeaway containers, you can use ice cream containers. Just make sure there isn't actually anything inside it. Just make sure that it's clean, that it's washed, and you can definitely use that to collect your stool sample. You can use tissue, fold tissue in your hand and, you know, poo directly into the tissue in your hand, or you can use a glove, or you can use a plastic bag. There's so many different ways, but this is a nice little infographic just because, you know, it's funny, it's cheeky, but it actually shows you the different ways in which you can actually collect your stool sample. Because believe it or not, people do actually, you know, they get a bit anxious about it, and they're not always quite sure about how to collect that stool sample. So I think this is a really great image to just let you know it's simple. It really is. No mess tactics. So yeah, hopefully that's something you guys can bear in mind should you need to do a screen at any point. So I'm going to bypass this little link. It's basically just a video. It's a cartoon video. You guys can Google it. It's a cartoon video for just showing you how to do the fit test. And it's literally 3 minutes long. It's by Cancer Research UK. So you can literally go on YouTube and put in Cancer Research UK fit test video, and it would come up. I'm happy to also share this link. I'm sure Tom and Lorraine can share it with you guys if you wanted, but I've basically talked you through exactly how it works anyway. It's just a nice little cartoon image of it again. Right, so prevention causes. So if you remember earlier on, I mentioned to you that 50% of lifestyle choices are actually linked to bowel cancer. And what that means is actually we can do certain things to try and reduce our risk of developing bowel cancer. Now, top 6 prevention causes for cancer in general are these 6 here. So it's smoking, obesity, diet, alcohol, and exercise, and sun. So that is not smoking, or reducing smoking where you can, but ideally not smoking. Being of a healthy weight, so not being obese, trying to ensure that you are keeping within your recommended BMI, for example. Having a healthy and balanced diet. Alcohol, so not drinking alcohol ideally, or making sure that you reduce the amount of alcohol that you do drink. Making sure that you have a regular amount of exercise as well. It's really important that we try and exercise where we can. You know, quite often people feel like they need to go to the gym and they're like, I don't have the time to go to the gym, and you really don't have to. It's really just about doing things that are going to increase your heart rate. So that could be just walking, you know, general walking a little bit fast, a little bit of fast-paced walking. That could be jogging, that could be skipping, you know, it's anything that gets your heart rate going. So it doesn't necessarily mean it has to be going to a gym. And I highlight this because quite often people feel like, you know, when they hear the word exercise, it means they have to be in the gym, and that can put them off. And no, it really doesn't mean that. It's just about making sure that you're doing something to make sure that your heart rate is pumping, and doing that ideally 30 minutes a day is fantastic if you can. You know, even if it just means if there was somewhere that you were going to drive, or you were going to, you know, it's if you could walk, you know, it's great. It's really just about trying to make sure you get your heart rate pumping. So that's something to bear in mind as well. And also sun. So reducing your exposure to sun. These top 6 are significant in terms of preventing cancers across the board. But when we start looking at preventing bowel cancers, we can actually see here the different types of things that you can do that could actually prevent bowel cancer. So what we say, this is again another brilliant resource from Cancer Research UK. They've got quite a lot of stuff actually. So if ever you need some resources, I mean, my next page will touch on resources, but if ever you want to find out a little bit more just about cancer in general, Cancer Research UK has so many brilliant infographics and images and things you can either order or just download online. And this is one of them. So what this does is it actually shows you the different types of, in terms of those top 6 we discussed, how many cancers can be prevented, how many bowel cancers can be prevented by ensuring that we stick to having a healthy lifestyle choices. So if we look at this, eating less processed and red meat can prevent up to 8,800 cases of bowel cancer a year. And that's just because we know that increased processed meats and red meats can actually increase our risk of developing bowel cancer. And when we talk about processed meats, we're talking about, you know, when you go to the supermarkets and you're getting things like packets of ham and sausages and all those kinds of things. These are processed meats that we know if we have too much of them can actually increase our risk of bowel cancer. And what this actually shows is that should somebody actually decrease their intake, it can actually prevent up to 8,800 cases of bowel cancer a year. Keeping a healthy weight can prevent up to 5,400 cases of bowel cancer a year. Eating more fiber, so including more fiber, having a healthier diet can prevent up to 5,100 cases a year. Drinking less alcohol, as we touched on before, can prevent up to 4,800 cases of cancer a year. Smoke-free, so not smoking, can prevent up to 3,400 cases a year. And being active, so making sure that you're including some form of healthy activity and exercise, can prevent up to 1,400 cases a year. So this is showing the amount of people that actually over the year have developed bowel cancer, and people have actually seen that could they have reduced these particular lifestyle or completely cut out these particular lifestyle choices, it could have prevented a particular bowel cancer. And I think that is so significant because, again, what that highlights is that more than half of bowel cancer cases could be prevented each year. So if we really just take into consideration our health and our choices, that could definitely help ensure that, you know, we reduce our risk where possible. So
can I ask a quick question?
Please do. Yes, go ahead.
Okay, my other half has just been diagnosed with this, and looking at that list, I wouldn't sort of say that there's a lot of that. What is the percentage genetically? You know, like in terms of like family, because we've looked at potentially what the family is involved. And I noticed that you're not mentioning anything about genetics, because can that not have a
Yes, no, definitely. It can have an effect, but it's not when it comes to bowel cancer. It's only a small. I mean, I need to get the exact figure in terms of genetics, but the reason that I didn't have that on here is because with genetics, although it does play a part in it, it's not as significant or as much as it does in terms of our lifestyle choices. So so that's the reason. But you're right, and genetics definitely does play a part, and that is figures that I can, because I wouldn't want to give you figures that aren't exact.
I understand.
So I'll definitely want to share that. But no, I think that's something to bear in mind, because what we know as well is whenever there's people that do have cases of bowel cancer within their family, one of the things is obviously quite often people will actually want to go for particular more testing for themselves. They might even do it privately. They might not necessarily stick to a screening program, because obviously, as we know, it only falls within a particular age range as well. But no, you're right, genetics does play a part. Obviously, lifestyle choices plays a bigger part, but we do know that genetics do have a link, and that actually is the case across the board with cancers in general. Quite often genetics definitely does play a part. It's just about the type of cancer and obviously the percentage in particular to that particular cancer.
Okay, thank you.
No, you're welcome, of course. Any other questions at all?
We do have some questions. I was going to save them until the end, if that's all right.
Yeah, no, of course. I've literally got 2 more slides, and then we can fly away with the questions. No problem at all. This is basically just a case study. So this is a case study, and the reason I've got this case study here is just to touch on the importance again of doing the screen. We've got a lady called Joy who was 61, and one of the things that she did was a bowel cancer screening test. However, Joy was, a prime example of what happens with screening quite often is that it's sent out to nationally, like I said, as long as you fall within the age range. So quite often people don't have symptoms. So Joy was actually quite healthy, exercised quite regularly. Only thing she ever really noticed was she would normally get quite tired at the end of the day, but that's just because, she had quite a busy lifestyle anyway. So she had generally a low perceived risk in terms of getting bowel cancer because, she assumed that she's healthy, she works out. She wouldn't assume that she would be at risk of bowel cancer. However, when she received her screening kit, she still did it. A good thing she did do it, because what happened is they ended up identifying that she did actually have bowel cancer. She went through treatment and now she is on the other end, completely clear and in remission. But what is so important about her is the fact that she actually did the screen regardless of the fact that she felt healthy, well, and fit. And the reason we touch on this is because quite often a lot of people don't want to do screening because they feel okay, they feel healthy in themselves, and they assume, well, if I feel fine, I don't need to do a test. And one of the things that we always highlight is that quite often you will feel fine, and doing screening is not about symptoms, because it is sent out to people, as I say, it's sent out to you as long as you fall within that age range. So quite often people may not have any symptoms. And one of the things about the bowel cancer screening test is that it has the ability to identify cancers either at the earliest of stages or identify polyps before they even turn into anything cancerous. So basically preventative measures. And it's really important. I think this case study is important more than ever, that no matter how healthy you may feel, if you can, please do the test, because it could genuinely save your life. And that's just a little case study we've got there that just touches on the importance of doing it. So my final little slide is basically just highlighting the different websites that you can go to get research, to get information. We've got Macmillan website, we've got Bowel Cancer UK, fantastic resource for everything bowel cancer related. And we've also got Cancer Research UK. So on here are just, screenshots of different things that you can kind of download or order. It all really depends on what information you require, but there is so much information across those 3 websites. So I would definitely say that for those of you on the call today, please make a note of these websites. Should you ever require any, factual information, up-to-date information, this would be the best place for you guys to go and get that. So that is everything from me. So all questions welcome. So Tom, I'm open to any questions that anyone has at all.
Yeah, can I just say thank you so much, Lisa Lena? That was amazing.
No, that's no problem at all.
A conversation that we don't naturally have within our families and friendship groups, but it is so important.
That's so
For everybody in this meeting, we are a family here, and we want to share information and ask questions freely, no embarrassment. And as you saw, Lisa Lena was able to speak to us, and you do it so fluently, and the whole embarrassment of like the stereotype, what people think bowel cancer is about, is kind of lifted.
Thank you, Lorraine. And I think something to really highlight as well is that, you know, I am aware that even on the conversation, as although we're talking about the different ages, the ages for screening, there might be quite a few of you that do not fall within that age range. But if it's still, you know, you may have family members or friends that do fall within the age range. So I'm really hoping that you're still able to take away something, even if it doesn't directly apply to you, being able to share this with people that it might apply to. And also outside of that, just understanding your own general health, because as I say, bowel cancer still can affect people that are outside of the screening ages as well. So just to touch on that too.
Okay, thank you so much, Lisa Lena. Andrew is first with his hand up.
Hi, Lisa. Thank you so much. Wonderful presentation.
No worries.
Can you just tell us any about issues like with men as well? So I'm a young man, well, turning 50 in 2 months now. 2-3 months time. So what issues or what barriers do you have with men coming forward as well? We all know the issues around prostate cancer. So I mean, what are the issues with men, and do you have a lot of men coming forward, and if not, what do you do to engage men?
Thank you, Andrew. Really good question. So I think what we've found with men generally, and to be honest with you, I don't want to single it out only to just men, because we know that we get issues with women as well. But what we have found consistently is that quite often men do not do the screens. And I think we've had so many discussions and, you know, deep dives into the reasons why. And I think what we found is just historically, generally, women have always had, you know, take a little bit more time in terms of going for their health checks, you know, and being able to actually do things that apply to them in terms of their screens, for example. We know that with men, there are many different factors. There may be work, they may not be able to get time off of work, they may not understand the importance or the significance of doing a screen, they may not have the time to see the health promotion that might be out there, for example, on TV and stuff. If you're quite busy, if you've got a family that you're looking after, you may not take the time to be, you know, sitting in front of a TV to be able to see the, you know, the promotions that might be around bowel screening. Things like that we know are true, and they definitely do affect men. And because of that, we do not see as many men coming forward and doing their screens as we should. One of the things that, or one of the ways that we hope to try and increase it, is doing things like this, Andrew. So being able to actually get out into the community and being able to actually raise awareness where possible. I mean, unfortunately, obviously lockdown played an effect in us being able to actually get out there and engage within the communities. But things like this and what I'm doing today is really significant, because what we can do is actually try and engage wherever possible, try and get promotion out or get people to come and to talks like this. Also, I work a lot with GP practices. So, I mean, predominantly a lot of my work is working with GP practices in addition to the community work that I'm doing like now. But one of the things that I do with GP practices is focusing on how we contact each of those non-responders. So non-responders are what we call the patients that receive their screening kit and they don't do it. And so what happens is whenever a patient doesn't do their screening kit, that information, we get that information and we share that with the GP. Now, one of the things that I do is work with GPs to be able to identify and looking at, okay, the people that haven't done their screen, are they men? Are they women? And if they are men or women, what do they fall under? Do they fall under the BME community? Do they have learning disabilities, for example? We're able to do deep dives and identify the different cohorts of patients that aren't responding, and then from there try and target them that way. So I think, you know, being able to work with health professionals is key, but also being able to engage in the community like I'm doing now is the best way. And in addition to that, what I hope is that any information that I share, obviously people like yourselves will then pass on to other people that you may know that might fall within the screening age, and, you know, just hoping that that will have a knock-on effect.
Thank you.
You're welcome. Did that answer your question? I hope it did.
100%, and even more.
Yeah, perfect. Any other questions at all?
Yeah, I have a question, but mine's pretty simple. It was just, is there any way that we...
I think you've been muted.
Oh, sorry. Is there any way that we can access these slides like after today, just because they were very useful?
Yeah, I'm more than happy to share. Yeah, I can share it with Lorraine and Tom and they can forward it on. No problem.
Brilliant. Thank you.
You're very welcome.
Lisa, Lena, there was a question in the chat.
Mm-hmm.
Somebody was asking, do you know how people with visual problems manage with their tests? Is there anybody to help them?
That's a good question. So one of the things, and that's a really good question, I'm glad someone asked. So one of the things about screening, and I always highlight this, is, as I said before, the screening test is sent out to people that fall within the age range. So the only information that we have whenever we send out tests to patients is just basically their address and knowing that they're eligible. So as long as you're registered with the GP, we will send it out. What that unfortunately means is that we don't ever have access to medical records. So we don't know whenever we're sending out information, we don't know if the patient has learning disabilities, if they can read, if they're visually impaired, for example. We don't have access to that information. So that is why a lot of work, and currently what we're trying to do is encourage GP practices that know their cohort of patients to be able to engage and support patients where possible. Because what happens is when you receive a kit in the post, there is information on the letter, and it does say, should you need further help and assistance, you can contact the Bowel Cancer Screening Hub. But if somebody is visually impaired, they may not be able to get that. So they may not be able to read that and understand that. So what we would hope is one of two things. We would hope that in an instance like that, they would be able to access, they would have someone, either a carer or a support worker, someone that would be able to be there to assist them, to be able to actually read and understand that, okay, this is a fit screening test, and would support them in doing that. We would hope that that would be the case, particularly. But if not, we would then also hope that the GP has actually enabled themselves to be able to identify patients that fall within a screening age that they know would need further support and assistance, and we would then hope that a GP would be in contact with that patient to give them further support. The only issue around that is that GPs do have a lot of work going on, so that may not always be the case, and therefore it would ideally be the latter, which would be that hopefully they've got a carer or somebody that would be able to support them in order to actually do their screen. Those are really the only two ways that we would be able to assist in that particular instance, just because we don't actually have access to a patient's record. So when we send out the kits, we don't actually know. Hope that answers the question.
We had another one from Jay, which was, if you have a total hysterectomy, can you still get bowel cancer?
I didn't hear. If you have a total
hysterectomy,
can you still get bowel cancer?
Yeah.
Yes, you can. So, and that's why it's important to still do your screen. Really important to do your screen. And it's a really good question.
I also had one as well. Sorry, forgive me if you said this already, but how long does it take for a screening and also for the fit results to come through?
Yeah, so in terms of actually doing the screen, it's really instant. It's whenever you go to a toilet and you collect your stool sample. In terms of sending off your result, what will happen is once you pop it in the post and you send it off, you should get your results back within 2 weeks. Ideally, you should get it back within 2 weeks. And what will happen then is, if your result is negative, then that is fine. As I said before, you will not receive a kit until another 2 years later. If it is positive, you will then be given an automatic appointment with our SSP, with our specialist screening practitioner at the hospital, to be able to discuss what that result means. And that should be within 7 to 14 days of you receiving that result that said it was abnormal. So everything works quite quickly. There's always a 2-week turnaround. So ideally 2 weeks in terms of getting your results. And then from that, if it's a positive, you should then get 2 weeks. Within 2 weeks, you should then now receive an appointment with your specialist nurse to be able to discuss what the next steps would be. And as I said, the next steps, ideally, providing you are happy and they feel it is suitable for you, the next step would be a colonoscopy.
Thank you very much.
Yeah, see 2 questions. 2 hands up, I mean. Delia and Lizzie, I think.
I think Delia was first. There we go.
Hi, thank you so much. Hello, thank you so much. There's a lot of information. I must admit, I was feeling quite stressed at the beginning, but then hearing you, you know, I now feel much more calm. So that's good.
Thank you. What were you feeling stressed about? Was it just the intake of information or
about
what?
Cancer.
Yeah.
I think talking about cancer, it's such a big word for
and
me.
I think what you say is so key, Delia, because it's one of the things. And I think when it comes to talking about cancer, quite often it can feel so heavy, and you know, people can feel a bit anxious about it. And you know, it's understandable, because I think we see so much, and quite a lot of us have seen people affected by cancer, and we know that it can be a very, very difficult time. So it's completely understandable what you're saying. And you know, I guess today the main aim was to just be able to encourage people where we can, if we know that there are things that can work in our favor, you know, just being able to take advantage of that. And I think with bowel cancer screening, knowing just the advantages of doing a screen is just fantastic. So I'm glad that you were able to, you know, come away from this and not feeling as anxious as you were at the start. I'm really glad to hear that.
Thank you. So my question is about the kind of emotional, psychological support that I believe both. I mean, I'm thinking about couples, because I have a friend who's actually leaving that her husband has been diagnosed. I don't know what type of cancer, but she believes she doesn't need the support. She believes he needs the support.
Yeah.
Oh, he can. And I'm like, I think you also need support. Anyway, so basically, so can you maybe touch on the support available and for how long, you know?
Yeah. So it's interesting, because every area is different, actually. So generally what will happen is whenever you get a cancer diagnosis, you will always be assigned to a CNS, so a clinical nurse specialist. And that clinical nurse specialist will be by your side, will be there for, you know, support any questions that you have, any concerns that you have. And that is particularly for the patient. But in addition to that, you mentioned a very good point. I think family definitely do need that further support. And there are different charities and different organizations that actually give support around that, particularly with Bowel Cancer UK. So if you go onto their website, and Cancer Research UK as well, to be honest with you, and Macmillan, all of them. But what will happen is each of these charities actually have different platforms. They have telephone chat lines that you can go and you can contact if you need further support. Also locally, it depends. So every area is particularly different. I think in Croydon, I would need to look into exactly what other charities there are, because the main ones that I know about are Bowel Cancer UK, Macmillan, and Cancer Research UK. I know that they have dedicated platforms and online platforms, and also telephone platforms where you can actually get support for family members as well. And sometimes what you'll find is, depending on the borough as well, there might actually just be individual charities outside of that, like smaller charities that give support. And particularly within the hospitals, it's always a good place to start. So whenever you get a diagnosis, or a family member might get a diagnosis, their CNS should normally be able to give support in terms of what further support family members might need, because they know better than anyone that when there is a cancer diagnosis, it's not just the patient that it affects. Exactly as you're saying, it's going to affect the family. You know, even if they don't initially think that it might affect them, you know, later on seeing a loved one going through treatment and stuff like that, that can have an effect. So what you should find is that in an instance like that, a CNS will be able to give further support. But if someone like yourself, Delia, is just interested, what I would definitely say is, online, if you go to Cancer Research UK, so the links, I'm going to share these slides and I think they'll share it with you guys. But if you go into Cancer Research UK, they have a dedicated nurse helpline where they can give further support to people, patients and family members. I know Bowel Cancer UK, Macmillan UK as well do the same thing. So there's always platforms online, particularly with these charities, that can help. So yeah, it definitely is worth looking online. And like I said, in particular areas, so in Croydon there might be local charities. I'm not familiar though with smaller local charities that might help the families, but I do know that the bigger ones like CR UK and Macmillan and Bowel Cancer definitely support. So definitely it's definitely good for families to get on board and get that support where they can as well.
And in general, that would be free support to access?
Yes, it's free support, completely free. And I think that's one of the things as well that I think is so significant when it comes to cancer. You know, the fact that it is free support and there is support out there, it just goes to show, like, particularly with particularly out there, we want people to be able to get support wherever they can. It is so important, because sometimes it can feel like a lonely journey, and we don't want people to feel like that. And sometimes there are people that get diagnoses and they don't have family around, you know. So because of that, we need to make sure that they always have support where possible. So yeah, it's all free support, and if you go on the websites, you can definitely find information around that as well.
Thank you so much, Lisa.
You're welcome.
Okay, Sonia's next.
Hi, Sonia.
Hi. Hi.
Hello.
Hi. My apologies. I just a little bit late.
No,
yes. My question is, sometimes I found that the GPs they quite delay on diagnosis, because when you go with some questions and you request them that I'd like to have like a general test and everything, yes, to find out what I do have. And first of all, you go there, they say that you have only 10 minutes to explain what you have. And sometimes you have more than one problem. So how can you spend, you feel like why I came here for, first of all. Then you have more one issue. And the main issue is, first of all, they advise you to give medication and go and come back. So it's quite difficult. I've been through this for completely 1 year. So when they decide to do further investigation, it was quite late for me. And I feel quite disappointed and really, really, really upset. No, for being diagnostic is because of the delay. And most of the time, our GPs, our doctors, they do fail. I have to be honest, they do fail and have to be precise. And when you go and you say like you have this particular problem twice, so they cannot keep giving you medication for how long? So you have to go straight away deep in investigation and they go further down. And another thing that I see even in the TV and society, men, they always put them on the side. They talk about mostly about the women in all aspects. And we know that the men usually is their nature. They like to avoid to seek the doctors, to seek help. That this is something that we cannot change. And then I think the advertisers should help them more as well, to make them engage, or to make quite as an enforcement anyway, for the things to change. Because when it comes to men, they are always placed in the second plan, and we talk about women's 24/7. And the men, no. Thank you so much.
No, you're welcome. You're welcome. No, I do. I understand what you're saying. I think the only thing that I can really say that is, obviously I know that within GP practices there is so much pressure, and you probably hear that a lot, but you know it's not easy. I think they do have pressures, and there's targets, and there's things that they need to do, there's patients they need to see. So sometimes, you know, patients do complain about that 10-minute time slot, but you know I do know that quite often they are doing the best that they can. It sometimes doesn't always help in that situation, and I do apologize for that. I know that's not easy, but one thing I would say is that you know, everyone, like I said before, we all know our bodies better than anyone else, and if you are really concerned, if anyone ever feels that, you know, something just doesn't feel right when you go to your GP, you know, your GP, you know, it's something you need to push on if you know that something doesn't feel right. And you know, GPs generally, they are there to help us. So if they feel that anything is really an issue, the next step should be further testing. And I'm not just talking about for bowel cancer, I'm just saying in general, if you go to your GP and there is a cause for concern, the next step should be for them to do further testing, because what they want ideally is to make sure that you're healthy, to make sure that you're fine. Obviously there will be instances sometimes where things can be missed or can be a little bit delayed, and that is really unfortunate. But I would say don't ever let that still deter you from going to seek help from a health professional should an issue arise again in the future, you know, because, you know, the best bet is to go and get yourself seen to where you can. I think that's something that I would definitely encourage. And in terms of the men, yeah, definitely. Yeah, we probably could do with a lot more health promotion around men, particularly because we know that with with men, they don't always take their health, or maybe even get time to check with their health as they should. And that's why we have things like today. And we do know that, I think, you know, even in terms of public health, it's something that is known, and there are things out there that are being done to try and make sure that we are more inclusive and that men are included in terms of, you know, particularly when we're targeting around particular health checks. So it's something that's known, and I know that work is being done around it, and, you know, small steps, hopefully we will get there. But definitely good points to be raised. Thank you, Sonia.
Thank you. You're welcome. Thank you so much. I really appreciate.
You're welcome.
Thank you, Lisa. Okay, yeah, Joe Francis. Hello, Joe. I think you're still on mute. Cool.
Hi. Can you hear me now?
Yes.
I just wanted to ask if these, especially as this session is about targeting particular ethnic groups, whether the leaflets are distributed in any different languages to really help people to understand what information that they're actually being asked for and why. Lots of people don't want to do tests that they don't know why they're doing them, screening or otherwise. So is there an explanation of what the test, what the benefits of the test are, and also are they in other languages when they're sent out?
Thank you, Joe. Really good question. So yes, there is. We have a range of different information in different languages. The only thing, again, as I said, we don't have access to medical records. So whenever we actually send out information, initially it's always sent out in English. And the only way you'll be able to get access to that is when you were to actually get in contact and let us know that, okay, English may not be a first language. And so the only way that can be done is by reading the letter, right, and seeing that the number that's
exactly.
And that is an issue. What we can only hope is that if English isn't somebody's first language, that they might have support in some way, shape or form, or they might know someone to speak to if they have a letter come through in English that they would need translated. Sorry. So yeah, that's the only thing, but there is information available. It's there. We have it in other languages. It's just been able to get through to us, and that can be the issue sometimes.
That's so unfortunate, because you pick up a child for a toy for a child in a shop, and it comes in 70 different languages. You go to IKEA, you can buy a piece of wood. That's okay, and it's coming in 70 different languages. Something medical that could save your life, and it's in a language that you don't understand at an age where you may not be open to wanting to be tested for all sorts of things. How can you get past that if you obviously, I understand you can't have patient identifiable information, but equally the GPs are busy. So the same people that you're trying to attract and get through the screening process actually are limited by that accessibility.
Yeah, and you're so right. And I think in instances like that, that's why a lot of work is trying to be done with GP practice as well, because GPs know their patients, right? So they know particularly the patients that English may not be their first language, or they know the patients in their practices that fall into particular cohorts. So that's why that is probably another way, and it's just about whether GPs have the capacity. Another way is, as I said before, being able to actually identify their patients that are eligible for screening. And then those patients that are eligible for screening, being able to see, do they need any further support? So if a GP is able to identify the patients that are eligible for screening and able to say, okay, do they need further support? Are these patients, is English their first language? Do they suffer from a learning disability? Any type of disability in any way, shape or form? If they know, then they're able to access and support those patients. But, it's kind of, it's a tricky situation. It's like you say, it's a catch-22, because ideally you need to be able to access these patients, be able to give them support. And if we're sending out letters and it's not in different languages, the only problem is it would be very difficult to send out the way that the bowel cancer screening letter is. It would be difficult to send it out in all these languages the way that it is, the information that is portrayed. But I do understand what you're saying in terms of it's true. You do go to shops, you do get toys, and you do see in the small print they've got different languages, French, German, all that kind of thing. So it's a difficult one, but that's where work does fall under GP giving further support where they can, and identifying patients that need further support. And that's one of the things I always advocate. So the GPs that I am engaging with, and I always engage with, one of the things that we always do and I always try and encourage is for them where the opportunity arises to be able to identify patients that fall within a cohort of bowel cancer screening ages, and making sure that if there are any patients that they know need further support, being able to get in contact with them. And that's the only thing that I can continue to advocate, and hope that patients aren't missed.
Thank you.
You're welcome. Any other questions at all?
Sonia's got her hand up, and Lizzie. Sonia, did you have another question?
I think it was still raised from before.
Was it still earlier? All right. Okay. Lizzie, go ahead.
Hey, my question's probably going to make me sound stupid. Sorry.
No stupid questions here. Honestly, ask away.
Basically, is bowel cancer, is that the same as colon? Is bowel and colon the same?
Cancer. Yes, it is.
Oh, okay. Sorry.
No, it's fine. It's fine.
We have another question in the chat. It says, what are the stages of cancer and what do they mean? Can be confusing, can sometimes be confusing.
Yeah, no, of course. So there's 4 different stages. So you have stage 1, stage 2, stage 3, stage 4. And the different stages is basically just means in terms of how progressed the cancer is, and in terms of, how difficult or how easy it might be to treat. So if you have cancers in stage 1 and stage 2, that's the earliest stages of cancer. So we're looking at basically it might be localized, so it might not have spread, for example. Quite often if we get to later stage cancers like stage 4, that actually means that quite often they might have spread, or they call it metastasized. So that means that a cancer might have started off in a particular spot and might have now spread to other parts of the body. And we want to try and avoid that where possible. So that's saying it in the simplest terms as possible. But yeah, it's basically just about whether the cancer has spread, how far the cancer has spread, and in that instance, that will then determine the type of treatment that a patient would then need to undergo. I hope that answers your question. I tried to say it as simply as possible.
Thank you.
You're welcome. Any other questions at all? Is that Roxanne's hand up, or was that?
It is. Good evening. Thank you so much for tonight's informative chat. Let's see if I can put this into a sensible question. Obviously, you're saying that if GPs know that their patients have additional needs, they'll be aware of it.
Not necessarily they'll be aware of it. It's just something I encourage, but it's not written that GPs have to do that. So that's something to highlight. So it's just one of the things that I would suggest to a GP, but it's whether they have the capacity to do that. I'll highlight that. Yeah.
Okay, so this may not necessarily be an additional need, but if the GP is aware that the particular patient has sickle cell or thalassemia, once they get into the fact that they have a positive fit test, is there something additional within the process that would be in place for those particular patients?
So are you saying if a GP identifies that a patient has sickle cell, would they further support them in doing their screen? Is that what you mean?
Well, just if they have sickle cell and their fit test is positive.
Would the GP need to do anything more, do you mean?
No, would the treatment be different?
If a patient has a positive fit test?
And also has sickle cell or thalassemia?
Okay, so, that's a good question. So in terms of the natural stage, so whenever you have a positive fit test, the natural stage would be, the next stage would be to do a colonoscopy. Ideally, that is the process. So they've identified a little bit of blood in the stool. The next stage would be to actually look inside the person's their bowel, look inside their stomach, and see what's going on. So in order to do a colonoscopy, they would need to do they'll basically need to place a camera through the back passage and be able to check and see if if there's anything going on inside the stomach. If somebody has sickle cell, what would need to happen then is they would actually need to have a discussion with our specialist nurse, and it would depend on the particular needs of that patient that has sickle cell. So providing that that patient is fit and well enough to be able to do a colonoscopy, because the colonoscopy basically just involves, as I said before, placing a camera through their back passage. They can be given like something to alleviate them doing their colonoscopy if they're anxious. So for example, you can have a bit of gas and air if that helps you, if you need a bit of further support. So it would necessarily depend on the particular health of that person and if they're able to do it. Regardless of a patient having sickle cell or not, the standard procedure would be to do a colonoscopy. And I would assume that providing the patient is healthy and fit and well, and not in a crisis, for example, I would, and hopefully doing the colonoscopy would not trigger a crisis, providing that is safe to do, then that would be the next step. But that would actually depend on the conversation they would have with our specialist nurse. And what the specialist nurse would always make sure is that obviously if a patient does have sickle cell, these would be the things they would discuss. They would make sure, is there anything that could trigger a crisis? Would a colonoscopy be safe? And if not, then they would then need to look at what the next steps could be. And what we do have is the ability to be able to do it's called a CT colonography. So it's basically able to look at your stomach. It's in addition to a colonoscopy, it's something that you can do to actually, it's not as invasive. So it's not placing a camera through their bottom. It's more doing a scan of their stomach to be able to see if there's anything going on. It doesn't give you as great an image as a colonoscopy, but it would be down to the specialist nurse to identify if that might be more suitable for a patient with sickle cell. So it really does just depend on that particular patient's history and their health and whether it would be suitable. But a discussion would be had definitely to make sure that it is safe to do. That's one thing that our nurses would always make sure. As I said before, we don't have access to medical health records. So if it was then now brought to our attention that a patient had sickle cell, then there will definitely be a discussion to make sure that the next steps would be as safe as possible for them. Hope that answers your question.
Awesome. Thank you, Lisa. We've also, sorry, I know you may have answered this before. Someone has also requested the slides for today's events.
Yeah, that's fine. I'll share it with you guys and then you can just...
Awesome. Thank you so much.
No problem.
Okay, so just like at the beginning of our session, we had a poll up. So I'm just going to put the poll up again with the question. If you could all just answer this question for me. Let's see how we're all feeling right now.
We can see you, Lorraine. Your camera's working.
Oh, and you can see me now.
Yeah, we can see you.
Yes, exactly. I wasn't going to be defeated by technology. I did it. Okay. So you should see it pop up on your screen now. Okay, so I'll give everybody another 10 seconds. Okay, so I'm going to end the poll now and share the results. There we go. Can everyone see that?
Yeah.
Okay, so see that a lot of our viewers today got a lot of information. Thank you so much, Lisa Lena.
No problem.
And they probably better understand the process and the importance of it. So I see a lot of yes.
Good.
There.
Good.
Okay. There we go. So hi, everyone. Thank you so much for tuning in, everyone. It's so important that we get together and have these type of conversations so we can better equip ourselves to know what we need to do for ourselves, and not only just for ourselves, but for our loved ones. So a lot of the information today, like you said, doesn't necessarily apply to me today, but I do have a lot of family members and friends that it does apply to. So I know the right questions to ask them and kind of encourage them and what kind of support that they may need.
Yeah.
And just like you said, we maintain everything in life. We maintain our houses, our cars, our nails, our hair, but we always forget to neglect ourselves. And it's so important to remember to look after yourself, your health, physical, mental.
Yeah.
So thank you so much, Lisa, for speaking with us today.
No problem.
Truly appreciate you.
No problem.
Yes, and thank you, Tom, as well, for co-hosting with me, and my other colleagues who have been in the background supporting. Thank you. I'm just seeing. Yep, and getting a lot of thank yous in the chat as well. So thank you for everyone tuning in. We will be we have some events coming up within the next few weeks. So if you're subscribed to our mailing list, you'll get those, and we'll keep you updated with all what we're doing with the Cancer Awareness Project. Yep, Tom.
Yep. So yeah, like I said, keep your eyes and ears peeled and posted. Yeah, there'll be some events coming up. Yeah, some of them are already going to be popular events around town, such as the Carnival, the Pride of Croydon. There's also Pride in Wandle Park. And sorry, that was just my phone. Yeah, and a few of you have already asked for the slides. And like I said, we've got focal groups coming in. So yeah, just pop into the Wellness Centre or Asian Resource Centre, and Lorraine and myself will be happy to accommodate that. And yeah, this has been our first one. So thank you all for joining us.
Yeah.
You guys have done a great job. Thank you.
Thank
you so much. I really appreciate.
Thank you for attending.
Thank you. Really knowledgeable event. Thank you so much.
Thank you. We'll see you at the next one.
Okay. Thank you. Bye.
Take care, everyone.
Bye. Bye, everyone. Thank you so much.
Thank you so much.
Thank you, Lisa. Thank you.
You're welcome. Bye.
Bye.